Hello everyone. This video is presented by second year BSc in Occupational Therapy students, Bangladesh Health Professions Institute. In this video, we are presenting the range of motion of elbow that allows us to perform flexion, extension and forearm supination pronation. Range of motion means the extent or limit to which a part of the body can be moved around a joint or a fixed point. Range of motion can be active or passive. Active range of motion is the amount of motion at a given joint achieved when the patient contracts the muscles voluntarily. Passive range of motion is the amount of motion at a given joint when the joints moved by an outside force. Typically, the outside force comes from the therapist or therapeutic equipment. Why do we measure joint range of motion? It helps us to guide the treatment, to evaluate the treatment, to analyze the treatment. Procedure for the measurement. The patient should be seated if possible. The patient should perform the motions bilaterally. If not, the unimpaired or least impaired side should move first to set a baseline for normal for this person. Observe for complete movements, symmetry of movements, and timing of movements. Demonstrate the movements if the patient has a language barrier or cognitive deficit. To estimate the amount of active movement in the following motions, give instructions. Before starting the procedure, sanitize the hands. Let's see how to measure range of motion in elbow flexion and extension. Patient's position. Patient is in seated position. It can also measure in lying or standing position, which depends on patient's comfort or the condition. Here, we are using a full circle goniometer. At first, palpate the lateral epicondyle of the humerus and place the axis on that. Stationary arm will be parallel to the longitudinal axis of the humerus. This is the elbow extension. Significant elbow extension is not typically seen in the adult population, but children and some hypermobile adults may demonstrate 10 degree to 15 degree of hyperextensions at the elbow. Now, give the instruction to the patient. Move your arm toward shoulder and touch. Movement of supinated forearm anteriorly in the sagittal plane is 0 degree to 150 degree. Let's see how to measure range of motion in forearm supination and pronation. Patient is in seated position. Elbow is 90 degree flexed and arm is at the side of the body. It can also measure in lying or standing position, which depends on the patient's comfort or the condition. Here we are using a half circle goniometer. Supination. Place the axis of the goniometer in the longitudinal axis of the forearm displaced toward the ulnar side. Keep the goniometer at the volar side of hand to measure supination. Stationary arm is perpendicular to the floor and also parallel to the humerus. Now, we will give the instruction to the patient. Move your volar surface toward the roof. Movable arm will be placed as the forearm moves across the distal radius and ulna on the volar surface. Generally, the forearm supination is 0 to 80 degree. Pronation. Keep the goniometer at the dorsal side of hand to measure pronation. Stationary arm is perpendicular to the floor and also parallel to the humerus. Now, we will give the instruction to the patient. Move your volar surface toward the floor. Movable arm will be placed as the forearm moves across the distal radius and ulna on the dorsal surface. Generally, the forearm pronation is 0 to 80 degree. Precaution. We should know about the precaution during evaluating the range of motion actively or passively. Limited motion protocols may require the motion only be tested within the limits prescribed even if the patient feels they can move beyond these limits. For example, following tendon repair. Avoid pushing passive range of motion when the underlying cause of the limitation is unknown, particularly with trauma. Avoid increasing edema or pain for the sake of measurement. For example, immediately following casting, the therapist would expect tightness of the tissue that have been immobilized.